Good afternoon, Facebook family. We wanted to welcome you to our official launch of Charis Health Coaching. Today is our official launch, and so we wanted to just hop on and give you a little insight to Charis Health Coaching, what we can offer, give you a brief introduction of ourselves. I'm Tiffany Small, and this is Diana Ferrer. We have known each other, it feels like forever, but we are nurse health coaches, and we are going to be hopefully working with you to achieve those health goals that you've set for yourselves. And we just wanted to introduce you to our new endeavor.
Yes, not only have we known each other for such a long time, but we've been nurses and in healthcare for years and years. And so for this is like a coming together, a culmination of something that we've talked about over the years about how we can make the greatest impact on people's lives, doing the thing that we love and the passions that we have about, with regards to everybody living their healthy. So for Charis Health Coaching, living your healthy is our motto. We want you to live in the healthy that you were designed. Everybody's body is different. Everybody has different conditions. Everybody has different barriers and obstacles. And so it's important to us that we get to know how we can best serve you so that you can live your healthy. Our focus is really on individuals with chronic conditions, but we also like to talk to people who are maybe at risk for certain disease processes like heart disease or stroke or diabetes, whether you have hypertension right now or high cholesterol, any of those things. We want to help you to slow, reverse, or prevent progression of these diseases. And many of these are preventable through lifestyle changes. And so it's important to us to give you the right information and to help you along your journey.
So as an introduction to Charis Health Coaching, we're going to walk you through a little scenario to kind of give you an idea of what we do and how we can help someone along their health journey. So we have a fictitious character, Barbara, who is a 45-year-old wife and mother of two. And she was diagnosed with type 2 diabetes, a common chronic condition that many of us have been diagnosed with. She was diagnosed, say, a year ago. She sees her physician, who we'll call Dr. Sims. She sees him every 3 months. And at each visit, Barbara is so disappointed to learn that her hemoglobin A1C levels remain at 9.3. For those of you who may have diabetes, we all know how important your A1C levels are. So Barbara has given up her favorite sweets. She monitors her blood glucose daily, and still her numbers are not where she would like them to be. So Dr. Sims explains time after time that, this test reflects her blood glucose levels over a couple of months, 2 to 3 months or so, and that he would like to see her levels at 7.0 or less, which is ideal for her. So Dr. Sims advises her to change her eating habits, to lose weight, and do all those things that, we all have heard our doctors say before. And then he asks her to return in 3 months. So Barbara leaves the office, and she kind of leaves with the question of, okay, how? Yeah. What next? How do I achieve this? So she then, she may reach out to a friend who, may be connected with Charis Health Coaching, and has, formed a relationship with her nurse health coaches and has been able to create a different path and, maybe create this alternate ending for herself. So with this scenario, Dr. Sims maybe provided Barbara with a referral to a nurse health coach, or again, maybe you are connected with Charis Health Coaching and he asked you to return in 3 months. So Barbara sees her nurse health coaches or virtually, weekly, and they've helped her to identify her primary goal of managing her blood glucose levels. And with this relationship, she now understands that, maintaining her daily levels has a positive impact on this, this A1C level that has been bothering her so much. So she's learned how to monitor her level. She's learned, the right meal planning for her, because it will vary from person to person. She's learned what exercise routine works for her. And she's been able to work through barriers that she may have come up with. Maybe, maybe obtaining healthy food is a barrier for her. Maybe the upcoming holidays is a barrier. So, she's been able to work through those barriers and work through a plan where she's now at a level of 8.2 at her next visit. Dr. Sims is excited. She's excited that her numbers are moving in the right direction. And that's just an example of, how Charis Health Coaching can kind of change the direction, change the path of someone, on their health journey. Someone who has maybe been diagnosed with a chronic condition. Maybe they just have a family history of a chronic condition that they would like to prevent. But either way, Charis Health Coaching can provide the support needed to help with that journey. And that's just an example of how, we can help to change that path.
As we know, health can be so complex. Health conditions can be so complex. You take one medication, you get a different side effect. And so you're trying to manage like your primary condition. And then all of a sudden, all these other things are happening. And you can almost feel like you have no control over your body, no control of what's going on. And our goal is to help simplify things for you, help you understand and manage all the aspects of your health in a holistic way. It is about your nutrition. It is about your activity, but it's also about the medications you're taking. It's also about how you're feeling, how your family dynamics, your social dynamics. And we will talk about all those things. And so a part of it is bridging the gap between maybe what you discuss with your healthcare provider. Maybe you're not quite understanding what they're saying, or maybe you've attempted to do what they've told you, but you need a little more accountability in doing it. So that's why we're here. We have not only the education and experience, but as well as the compassion, the understanding to know that sometimes it's hard, sometimes it's rough, sometimes you just want to quit and give into whatever is happening to you. But we are here to cheer you on so that you can live your healthy and that you can reach those goals that you've always wanted to in a way that is realistic and safe and you have the support for. Our desire is to create plans based on your own personal goals, as well as provide guidance in decision-making, education. We can share with you different alternative treatment approaches that you can discuss with your health provider or help you gain a better understanding of traditional medicine options. And so there's a wide range of services or discussions that we can have to better be able to meet your needs as you progress in living the healthy version of yourself.
Right. So, just to kind of piggyback on what Diana stated, it's we are here to be a liaison between your healthcare provider and yourself. We are here to, help you translate to, what does this mean? We're here to help you understand what that diagnosis means. We're here to help you to understand, how you can live healthy with this diagnosis, because that is possible. Many people believe that just because they have hypertension or diabetes, that they're no longer healthy. Not necessarily true. You can live a healthy life with a chronic illness, and we are here to help you do that. Like Diana mentioned, we'll help you to identify goals. We'll help you to create a plan to meet those goals and provide you with what we think is one of the most important pieces, is to provide you with the support you need to get through, to get through those goals and to meet those goals. But another piece that people don't often talk about is we're also here to celebrate with you. So we're here to celebrate those tiny successes along the way, and we're here to celebrate your huge success at the end. So not only are we, helping you along the way, but we're celebrating with you, because that piece is just as important as all the other pieces as well.
And within celebration, I think about empowerment. It's like when you know that somebody is with you and somebody is for you, you're empowered to make better decisions and better choices. And we want you to be able to advocate for yourself within the healthcare environment or within the system, with your insurance companies, with your doctors, and any other providers. But also, if you're not engaged with the healthcare system and you're trying to manage your health on your own, and you're not quite finding the resources that you need, we're here to help you with that as well. But we want you to make decisions that you have peace about, that you can sleep at night knowing that you've done the best that you can to improve your health or to prevent any risk factors that you may learned about that you're at risk for. And so we want to talk with you. We want you to connect with us, and we want to hear your story. And you can easily do that by going to our website, mychariscoach.com, and either clicking on the Start Here button or scrolling all the way down and subscribing to our email list. We have a number of programs designed to help you that include those things like nutrition and fitness plans, dietary recommendations, just health education regarding your particular situation, in an effort to provide the best support we can for you. In addition, something we're also excited about that's launching in January of 2021 is our Health Esteem program. Tiffany, tell us about Health Esteem.
So Health Esteem is an exciting program we have coming in January. And what I'll do is I'm going to read a small synopsis about it, and then I will kind of break that down for you. So Health Esteem is a program to empower and support women with a primary focus on women of color through their personal journey of wellness. Through a robust health education series and a supportive online community, we strive to bring awareness to health issues affecting women, inspire action towards healthy options, and offer accountability to ensure healthy outcomes. Our desire is for women to raise their health esteem by discovering and defining what healthy means for them, and by providing the tools necessary to happily live their healthy. Now, that actually kind of summed up everything we just talked about. So I don't really know if there's much explanation needed. But one piece that I would like to kind of highlight is the health education series. So Health Esteem will include a health education series. Education is a big part of what we do, because armed with the knowledge, you'll be able to make good decisions, not only for you, but also for your family. So let's think about it. How many of us are taking care of tons of people, right? So as women, we take care of, we take care of, ourselves, right? A little piece. We take care of our children. If we have pets, our husbands. If we're part of the sandwich generation, we're taking care of our parents and maybe even our grandparents. So we are taking care of a lot of people. And who gets put on the back burner when we're taking care of all of those people? We are, right? So our focus is to stop that cycle, right? Yeah. Because if you are not taking care of yourself, then you're not able to take care of those that you love. You're not able to, take care of others in the community and serve your church and serve your neighborhood and those sorts of things. So it's important that you take care of yourself. So education for us is really big. We want you to know how important it is to take care of yourselves and what that means for you. So we'll be talking about, what healthy means. More importantly, what healthy means for you, because that's not going to be the same for every person. We're going to talk about chronic conditions and what those are and what those mean for you. What those mean, how those will impact your health in the long term. We'll talk about stress. How many of us are stressed daily? And homeschooling right now and working from home, and everybody's working from home, and you have a full house, a lot of stress, right? So we're going to talk about stress. We're going to talk about nutrition, and we're going to talk about fitness. And we're going to talk about, like we mentioned before, setting goals and helping you to achieve those goals. So Health Esteem is going to be a really comprehensive program, and it's going to cover all the bases. And so, we are excited about it, and we are hoping that you will join us, because we're going to have a lot of fun with it as well. And Diana has a couple of additional things that Health Esteem will highlight.
So another part of aside from the courses and health education, we have our community that we're building. It's a private, personal community that we'll be able to engage with you all, and you'll be able to engage with us. And together we will have discussions, we'll have guest speakers, we'll have gifts and giveaways. Why? Because we want to encourage you. We want to love on you throughout your journey. Sometimes it's about the motivation comes from knowing that somebody cares. Somebody cares that you're doing what's best for you. And so more information to come regarding Health Esteem. Look for it in the next couple of weeks. Again, go onto the website. And if you subscribe to our email list, we will be sure to get the information for Health Esteem into your email box. Our goal is to help at least 500 women in the first quarter of 2021 to make significant changes in their overall health that will reduce their risk for chronic conditions and improve their quality of life. I know you know someone. It could be your mom, it could be your aunt, it could be a daughter, or it could be yourself who just needs a little bit of support to reach those goals, to change those unhealthy habits into long-term healthy habits that really change the course, really make defining moments even better. You want the longevity of life, to live fully, to stay active, to stay present. And so we want that for you as well. So be on the lookout for that. And if you are interested in sponsoring a woman, hey, let us know, and we'll set that up as well. We're just so excited to really present this to you all. It's something that we have been like stirring around,
passionate about for years.
It's not just stuff. We have a team in place to make sure you have a great experience and continued support. So be on the lookout for that. Thank you so much for tuning in. The last thing I just want to tell you is on Thursdays, we will be presenting Healthy Inspirations. And it's just we'll have a guest on interviewing them. It could be you. You could get an invitation. And we're going to ask you a couple of questions about their health journey, and you will participate in a health quiz. And if you get the answer right, we'll know you know a little something about your body and how health works. But it's just something fun where we can engage with you and continue the conversations, because health is important. It is vital, especially during these times. We've learned what we can handle and like Tiffany was talking about, the stresses that may weigh us down. Stress is a precursor for many health chronic conditions: hypertension, high cholesterol, even stroke, heart disease. And so we want to make sure you are fully equipped and fully ready to experience life to the fullest.
Yes, we are here to listen to you. Listening is, one of the things that we are very in tune to. One thing I have learned being a nurse is that it oftentimes, what's going on is in the story. It's not necessarily, oh, I have this going on. But as we talk, as we build a relationship, there are things that we learn. And so we are here to listen to you, listen to, whatever your concerns are. As Diana mentioned, it's not necessarily just about health. Maybe it's insurance. Maybe it's navigating the healthcare system. But we're here for you. So we are excited. Thank you for joining us. And we would love to build a relationship with you. So we look forward to it.
Yes. And be sure to follow us on Facebook or Instagram at My Charis Coach. You guys have a great Saturday, and it was wonderful talking with you.
Wonderful talking with you. Have a great day.